Hello friends, I am Dr. Suparna Banerjee. I am a gynecologist and a fertility specialist. Today I am going to discuss a common problem or very common preventable problem as well. That is called that HPV virus infection or human papilloma virus infection, which is very prevalent in our society, but sometimes it get unnoticed, so we don't know when and where we are getting infected. So because it is a kind of endemic, so uh, without our knowledge it stays in our body. Some of the people whose immune system is very good, like any other viral infection, they protect themselves from that virus by developing a immunity. But some of us who do not have that good power of immunity, we cannot protect ourselves from that virus causing damage. So as a result, we get infection and its long term consequence. Like we already have seen the coronavirus, how it affected the society. Some of us protected by our immunity, who almost 90 to 100% all of us were affected that time, and some of us survived without any problem, some of us some problems, some of us admitted to the hospital. So same virus, same viral strain can have a varied effect on the population. So like the same, this HPV virus also can sometimes asymptomatic, sometimes causing problem, sometimes causing cancer. So why we are worried about this HPV virus? As a gynecologist, we are more concerned about our female reproductive area. So we see that in India, the major cause of female cancer, from where people or female or the women are dying in our country, is still cervical cancer. So it is one of the most common cancer or most prevalent cancer in India. There are multiple reasons for it, but nowadays all studies almost certainly confirmed that the main cause for this, you say almost 99.9% cause of this cervical cancer is HPV virus. And that is the human papilloma virus, which has got a effective vaccine available. So it is easy. If we use the vaccine, then that low potent vaccines means it's a live vaccine. So that low potency virus, if we take, then that will give us a good strong immunity, so that the actual bad virus or the wild virus, when affect us, we will be protected. So in that way we can prevent cancer. So as a gynecologist, we see the patients, we examine the patient, pap smear or the cervical cancer detection test and colposcopy. These are very common terms nowadays. Most of the urban population, they at least know the term, but not, unfortunately, everybody comes to us that quickly for a regular checkup and for this cervical pap smear, because it is not in our government protocol of preventable disease. It is not it is not been incorporated, but it's because of this all health budget and things. So preventable disease, we have got vaccination schedule, but it's for children. For adult vaccination, there is not, Indian government is thinking about it, because as 99.9% chance of cervical cancer prevention will be done by this vaccine, and think about the health burden. So government also thinking about the health burden that the cervical cancer causes. So if we can give vaccination and prevent a disease, that will be fantastic. So I will request all of the women that it is time, we should wake up and take the vaccine. Go to your nearest gynecologist, and you can have this vaccine easily. It has got 3 doses, There are two types of vaccine available. One is bivalent, one is quadrivalent. That means one containing two one will give you antibody against two virus, another will give you antibody against 4 viral strain. So you can take, so 4 viral strain is slightly better because it will give the two main cancer virus, immunity against these two cancer virus, another two benign viral strain. So HPV or human papilloma virus not only causes cervical cancer, it can cause cancer in our female reproductive system, like in vulva, vagina, that is our external genitalia there, that is another thing, and sometimes oral cancer, and for male it can cause penile cancer as well. So other than these cancer producing strains, this virus has got some benign strains as well that do not produce cancer, but that give us a bad bump in our body, that is called wart. Wart means it is like a cauliflower like small growth. It can happen in your any part of the body, mainly genitalia or in the mouth, in your skin, any part of the skin, and it is quite infectious, and you can touch yourself and you can spread the infection all over the body. So the vaccine will give protection to these benign warts as well as this prevention against cancer. And it is 3 doses we are at present given. Though usually the first dose we call 0 dose, and after 2 months you need to repeat the second dose, and the third dose is 6 months from the first dose. Now, which is the age bracket? You can give this to female of 9 years or more. So nowadays it will be coming in the pediatric vaccination schedule. Government is thinking about it. So usual we say puberty age is the ideal. So 9, 10, 11, from there we can start this vaccination. Who have passed that age, at any age you can take it, because cervical cancer, when it is going to happen, you do not know. So any age you can take it, but the lowest age is the pubertal age, that is 9 to 11, that is the lowest age. And so every female who are menstruating can take this vaccine, so that you can prevent cervical cancer. Regarding this vaccine, male, because it can cause penile cancer, male also need to take the vaccine. A special vaccine has come, single dose vaccine. It's for both for female and male. In the Western world, they have started vaccination for male with a single dose from around, again, 10, 11 to 15. So it is the high school stage. So they are giving the vaccine to the male as well, so that they will have, before they are exposed to the virus, they will have already immunity. And this virus transmitted sexually, so genital tract infection or genital tract, any cancer like vulva, vagina, cervix and penis, we are prone for this, because this virus can cause cancer for this. So my advice is, please go ahead and take your vaccine. It's just 3 doses for female, and for male vaccine also I will request, contact your nearest vaccination center, contact your doctor, and please get this jab done as early as possible.